All right, everybody, it's Dr. Chad Peters here. I am part of the drchadpeters.com. Imagine that. We are also a part of Rehab to Go, and on my YouTube channel, you've probably found us via Chad Knows. Today's topic, we're going to cover shin splints and a modern understanding and treatment. My idea today is to get you better informed on what's going on in shin splints than anybody that you know. So why we're bringing it up right now is because track season is on. Right? It's the end of January, and for all you guys in the northern states and in the Soviet Union and in Iceland, you guys may have not started track yet. You're just doing indoor season. But for the rest of us down here in the warmer states, like guess what? We're already out there on the track. And this is seen all the time. It's a very common thing with the start of track season. Now, it's seen in all sports. It just seems this time of the year is clinically where we start to get a lot of these things in. And over the last week, I have seen a lot of them. I got one of my buddies who is a track athlete in Kansas in college, and he called up and he said, hey man, I got these wicked shin splints and it's just not responding. Can you help me out? So we're gonna try to help you out, man. It's a super common issue for any practitioner. So your athletic trainers are gonna see these all the time. Physical therapists, your physios, pediatricians get these all the time because it's a lot of time in youth sports, and then sports-based chiropractors, which we are. So what's happening is the front side of your leg has pain to it, your lower leg. And that can happen on the inside part or on the outside part. And it's typically because your calf muscle is too tight and balled up and your front side muscles are getting too stretched out and long. And just knowing that is gonna help you guys out. We're gonna dive into it a lot more. So what we're gonna go over today is discussing the condition. Now, clinically, if you're a doctor or a practitioner, you're going to refer to this as anterior tibial stress syndrome, and that's a huge 50-sound, impressive sounding syndrome. However, I don't use that in my clinic a lot. Because I deal with athletes, I tend to use more nice or comfortable sounding terminology, so I will use the word shin splint. In the same breath, I will tell you, I use the words sprained ankle versus partially torn ligament in the ankle, right? One just sounds better, and I think it lets you as an athlete get it in your head a little bit easier. So we're gonna cover the mechanism of injury, and basically the MOI is what's going on, why is it happening, and then that will help lead us into how to treat it, how to do it the right way. What I want basically is for you guys to get a broad picture. You want to understand this thing, because if you don't understand what's going on, you typically are gonna treat it like Adrian the intern. This is Adrian, and how he likes to treat shin splints is just to get on some balls and roll them back and forth. Ah, it feels good, man, I'm just blasting it. And then he doesn't get any better. So let's get over this thing. Let's talk about treatment and what works, because my hint for you is it's not just one thing. If you're doing one thing like rolling on balls, it's just not gonna get better. So who's the video for? Well, first of all, it's for everyone because anyone can get shin splints. But the way I'm putting this particular video together, this isn't the one for practitioners. So I'm not going to get really deep into the actual treatments I do in here. I'm going to give you guys an idea of what's going on, the understanding, so you can do it. We're going to talk about a lot of discussions on treatments, but I'm not going to have big time videos on how we're using the cupping with fascia release at the same time, or how we're using some of the tools. We'll talk about some of that stuff, but I'm not going to get real detailed. My hope is that enough people watch this thing, they're like, hey, I do want to see the treatments. But for the most part, if you guys are having this thing, I want you to be able to understand it so you can get back with your athletic trainers or your chiros or your physios or your PTs, your pediatricians, and they can do this stuff the right way. And when you understand it, you're going to pursue it the right way. So what are shin splints? Well, it's pain on the front side, like I showed you on the video. It's usually either to the inside or medial or to the outside or lateral, but it can be both. Sometimes you're going to feel it up by the knee, sometimes you're going to feel it more down by the ankle, but it is pain on the bone. It hurts, and they hurt to touch, and it hurts to run, and it hurts to move, and when you get out of class after sitting there for an hour, it hurts. So why does it happen? Well, check out the anatomy on the artist rendition here. The calf is a big muscle in the back, and you guys know the calf. Go ahead and flex, get on your tiptoes, and see how that calf contracts. The calf on the back side is going to have an increased demand. When you decide you're going to start running longer or faster, or most common in like track athletes or athletes is they need to do both, the backside muscle has an increased demand. It needs to get stronger. So as that starts to contract more, the front side muscles along your shin have to elongate more, if that makes sense. It's like an eccentric stretch. Now I want you to look at the calves again and then like flex your bicep and your arm as well. Those muscles that can really contract big like that, they're connected at 2 points. They can shorten up very easy and that gets a big power burst. The muscles on the front side where you're having the problem, they don't quite attach like that. It's different than most of the muscles in the body. The shin is a very sharp angled bone and that muscle attaches the entire length. So when that muscle's having stress to it and it's having to work more, it's actually pulling on the bone. The pain that you feel with a shin splint is pain into the periosteum or the covering of the bone. Scary, right? But guess what, guys? It's very easy, so don't worry about it. And the typical response is very fast if you do it the right way. If you don't do it the right way, well, it seems like the shin splints just come back. They'll be better for a day or so and then they come back. So I just go to the gym and I roll on it again. Thanks, Adrian. So let's talk about treatment options. The old way is that you stretch out the calf, right? If the mechanism is that the calf is too short and tight, well, let's just stretch it out. That was the old way. Guess what? It didn't work very well, but I still see a lot of people doing that. It's just not good enough. The newer way, of course, is use any of modern technology. So let's tape it, or let's use these fancy tools, or let's get the hypervolt out and just pound it. I mean, there should be bruised shins up and down. Or let's just do the fancy cupping. Everyone's doing cupping. It seems to work for everything. Let's just cup it. Well, guys, that's not good enough. Let's do a better way. I want you to understand this thing so you can tackle it better, because this has to be done a certain way or it doesn't get better. So basically, the way we like to treat this thing is there are 4 steps to treating it. And you need to do all 4 steps, and you need to do them in the right order. It just doesn't get better. So much like everything you'll hear me discuss, the first step is to treat the inflammation. All right? If you don't treat the inflammation, which is basically your body screaming at you something is wrong in this area, you really can't ever get up into stage 2 and stage 3. And if there's anything that I see happening wrong in the way most treatment is done, is that we're trying to get right to the exercise and the release techniques and all the cool new stuff before we actually treat the alarm system. Somebody has to take the battery out of the fire alarm and treat the inflammation. So as you can see, I've got a couple different ways here. I saw these little, I think they're called Body Procs ice packs. It's a cool idea. You can find those things on Amazon. You can do the dipping. I know at the university that I work with, they have one of the cold tanks and it has a treadmill on it and they get those athletes in there all the time. It's great. I will tell you what I've seen that works the best is the old school freeze a cup, tear off part of the cup and do it. It's ice massage. And we don't, I like to use all the modern stuff. I like to keep it all kind of fresh and cool. But this is one of those from back in my dad's era that just seems to do the best. I've been working on shin splints now for 17 years clinically, and I still think nothing beats that cup. I think the fact that you're getting right on the periosteum, you can get in there deep, and you're doing like massage techniques while you do it, I would by far push you to take care of that with the cups. Now, just because I'm talking inflammation control, that doesn't mean you can't do everything else. You can still do some release work on the calf. You can still do some retrain on the front side, but that has to be after the inflammation is controlled. It can still be on the same day, but you have to get this one point. If the inflammation component is not taken care of, that's a huge part of the muscle hypertonicity. Why that muscle screaming at you is because that thing's under stress, right? In the sports world, we call it on threat. The second thing you want to do is you want to treat the imbalance. So if we're going to go over this thing and really understand it, the calf muscles are too tight and shortened. Let's loosen those up. You can massage those things. You can use the hypervolts. You can use all the funky tools I showed you. You can just get in there and work it, massage it. Use what you want to release the calf. It has to be done, but that is not enough by itself. You have to get the front muscles shortened. Those muscles are elongated. They're eccentrically contracted, however you want to call it. They're longer than they should be. And the way you fix that is by heel walks. When you stand on your heels and your toes are up in the air, you have shortened those front muscles. I tell people take 10 steps on your heels, take 10 steps on your heels like with a duck walk with your toes pointed out, and 10 steps on your heels with the toes pointed in. If you want a great way to remember this, just put a hair tie or a rubber band on your toothbrush. Every time you brush your teeth, now you're walking on your heels, it's 3 sets of the legs in different positions, like 10 reps. You should brush your teeth twice a day. You've got it done twice a day. All right? The next step, that when we've got the imbalance, is to move the joints. Now, I know I'm a chiropractor, so of course this sounds very normal for me. But I don't care if you're an athletic trainer, PT, physio, whatever, you have to get in there and make these joints go. Remember, the muscles are all attached to different joints and bones in the body, right, via tendons. So if you have a joint, especially like fourth and fifth metatarsal and your navicular and the way it comes around the front, and those things aren't moving the right way or in the wrong position, you'll never get those muscles into the right position. Now, mobilization can take a while, and that's one of the advantages of chiropractic. As much as I like to preach, like I try to do stuff different than standard chiropractic, we do have one really cool advantage, is that when done correctly, we can mobilize those joints very, very quickly. So get in there and move the joints. Let's say you are in a state or a country where you cannot adjust. You cannot have a thrust. So let's say you're like an athletic trainer down here in Texas. You can still get in there and mobilize. Grab one joint, grab the other joint, get it moving back and forth. Again, this video, guys, is not for the practitioners, but I am going to make a lot of stuff for practitioners. I don't care what your profession is. I don't fight the war of who's right and who's wrong. It was never a good war to begin with. All of us are doing basically the same things. Get in there and move the joints. And then don't forget step 4, which is, most of us never even get to step 2. But if you are going to go through this, let's do it the right way. Check the body. So I got the dem bone song, right? The ankle bone's connected to the knee bone, you get it. That's what this is all about. Because most of the time, when you have an issue that's happening that involves anything in the feet or below the knee, that is because there's an increased demand on that area because stuff up chain isn't working. For most of you guys that are athletes, it's your hips, man. I mean, the hips are the easy player. And we'll get into some hip stuff. As you guys get more into my website, the hips are going to come up over and over and over again. It's typically a lack of internal rotation. It doesn't take stretching. It takes a whole different thing. But you've got to fix this. A lot of this is going to come down to getting with your coaches. It's all about your form, your mechanics, your techniques. If you are running like a slouch, and you're getting tired too early, maybe they increase the volume too much or they increase your speed too much, and you are starting to collapse your form, guess what? You're falling behind. On this note, I want this website to be insanely coach-friendly. The coaches are your best ones to check on form. If you are a student or an athlete and you're listening to this website right now and you think your pediatrician is going to help you out with running form, you're out of your mind unless that guy or girl was a highly trained athlete and stays with this stuff. This is the coach's arena. They need to help you out with that. So have them look at the form, because as you're treating this stuff, this all has to be done right. Now here's the best news. When you do all this stuff and you do it in the right order, these things respond insanely fast. It's a muscle imbalance. And I feel very comfortable saying the typical outcome is 7 to 10 days. It's very easy. Depending on how severe the issue is, it may take a little bit of active rest. But I've worked with runners since I started my career. Hey, I had shin splints, so I took 3 months off. I came back to running, and I got shin splints again. That's doing nothing. That's not rest. That's not even active rest. That's doing nothing. So you might have to have some active rest. So get with your professionals if you need to and get it done. If you do this thing correctly, you should get this working great. If you do it incorrectly, I would tell you expect no changes at all. And just like Adrian, you're going to end up with this thing on and off all sports season. If they get bad enough and they yank, your differential diagnosis or what this may become is a stress fracture. So it's very important that you don't have this yanking on the front side. So let's get into a little bit at the end here with what I'm seeing success with. Well, the picture on the right is me explaining this to Cameron about you just have to understand the body. And I had an intern in here last semester named Paloma, and she was just very cool about, I think what you guys do really neat in your office is the spiel. You give the patient the spiel. This is important for this condition. If you don't let your athletes know what is happening, they tend not to be very compliant with their treatment. If they just like, it hurts on my shin, why am I doing all this stuff with the calf? Why am I worried about my form? Why do I care about how my foot function is and my toes and how it's all working? They don't care because they don't have any reason how this is going on. So you guys just sat through the spiel. That's the same one I would give clients. One of the other things, I have a picture of Cameron in here. He's doing a lot of stuff that we're starting to call functional movement therapies. And it's the cupping. It's a different version. I kind of made fun of the cupping earlier. We use a version of it. I don't do Eastern medicine where I cup and I try to free up the chi. So what Cameron's got there is he's got these things hooked up and then he'll have you move them through motion. I initially started to put this video on here so you could see what we're doing. But again, this video is not for the practitioners, guys. This one is just built for you guys to get it. Go through your 4 steps. Start to work this thing. Make sure your mechanics are good and get successful. You guys can fix this condition. Hope you learned a lot. If you want more on it, just let me know what you're looking for and we'll get it out there. You just finished another Rehab to Go. I know you learned something. If you want to know when the next one's coming out so you can be ready for it, all you got to do is subscribe. Hit the little bell, it'll ding and tell you, hey, Chad's got another one coming out. Don't forget to tell your friends, especially those that are like-minded, the kids, the students that are getting into this industry. They know what direction they want to go, but no idea how to get there. This information helps them make those decisions. Look forward to seeing you guys next time.